The role of pain management physiotherapy. I am one of the physiotherapists within the Greater Glasgow and Clyde Pain Management Service. When physiotherapy is mentioned within the pain service, lots of patients have similar questions about why they're being referred back to physiotherapy again and what to expect. Within this podcast, we will answer some of your common questions. Why do we have a physiotherapist in the pain management service?
The physiotherapists within the pain service have specialist knowledge in helping patients with persistent pain. We understand that your pain is very real and can have a devastating effect on your life. You may notice changes in your social and working life, family relationships, and your mood. You may find that you have struggled with increasing your activity in the past or are not able to do the activities that are important to you. We will help you look at ways to manage your activity levels to allow you to live life well whilst managing your pain.
What might be part of my individual pain management physiotherapy programme?
You may find the physiotherapist initially does more listening and talking. This allows us to agree an individualized treatment plan with you. We will help you to understand the science behind your pain. We know that understanding more about your pain can help reduce the fears and worries you may have about your condition. This will include looking at your current activity levels. For example, are you doing too much or too little? Our aim is to find an activity level that is right for you and to increase this over time. We can help you improve your flexibility and general fitness levels. This may make your everyday activities more manageable. We will also spend time discussing topics such as your leisure and work activities and provide information on local groups which may be able to help give you additional support.
I have tried physiotherapy before. What will be different this time?
Whilst some of the treatments you have tried in the past may have been helpful, often many patients report that they only had short-term relief from them. The focus this time will be more about developing skills you can use in the longer term. This type of approach can take time to put into practice. It is important that you feel confident using these skills, and we will be here to guide and support you during this time.
What should I expect to happen when I go along to physiotherapy for the first time?
Your first appointment will be in a group setting. Experience tells us that most patients have similar initial questions about physiotherapy and their pain. These groups have been running for several years, and patients have told us that they find them informative. They also enjoy meeting others who are in a similar situation.
What does the group session involve?
These sessions will explain a little more about the science behind your pain. They will also introduce you to techniques to help you manage your activity and improve your quality of life.
How long will the group session last?
We recommend that you allow an hour and a half for attending. During this time, we would encourage you to move around and change position as often as you need to.
Is there anything I need to do before coming to physiotherapy?
We will have sent you a questionnaire pack. Please fill this in before you attend your first group session. If you find the forms difficult to fill in, please do not worry. The physiotherapist will help you at your first session. These questionnaires are important as they give us valuable information and we can use them to monitor your progress.
What happens after the group?
After the group, we offer everyone an individual appointment within 4 weeks. The purpose of this first appointment is to focus on your own individual needs and find out about you and how living with pain affects your life. This in turn will allow both you and your physiotherapist to come up with a plan for areas that you can work on.
How long will I have to attend pain management physiotherapy?
The length of time you attend will be based on your individual needs. You will have time between appointments to put into practice what you have agreed in your treatment plan.
Who else makes up the pain management team, and how do you work together?
The pain management team is made up of pain doctors, clinical psychologists, nurse specialists and physiotherapists. We meet every week, and if you have any questions for other members of the team, there is no delay in them being discussed. This means that if there are any necessary changes to your care, all members of the team are involved.
Thank you for listening, and I hope we have answered some of your questions about physiotherapy within the pain service.